So breast augmentations evolved over the years because of the evolution of the breast implants themselves. We originally used silicone implants until we found out that they weren't that good. So then we went to saline implants. And now with the newer generation of silicone implants, we're reverting back to silicone implants, which I personally prefer. There are multiple different kinds of implants. There are round implants, there are shaped implants, there are textured implants. And all of them have a role to play, and it's very dependent, as far as I'm concerned, on what the patient's anatomy is like and what their wishes are. And I usually will suggest an implant according to the patient's wishes. So the reason for the different implants is to give a slightly different look, to fit the patient's anatomy. I prefer silicone implants personally because I think they feel better and I think that they look better. I still use saline implants because a lot of patients want saline implants, and I do whatever the patient wishes within reason. There are multiple different incisions that are used for breast augmentation, including under the arm, under the breast, around the areola, and even through the belly button. I personally only use the crease, the breast crease incision and the areola incision. I used to do a lot of incisions through the axilla, but I was not pleased with the results through there. Since I'm using a lot more silicone, it's much easier technically to put them through an inframammary crease incision, the one in there that's hidden underneath the breast. And interestingly, I've changed a little bit in that most US surgeons place the implants under the muscle, which I used to do as well. I'm starting to put these newer implants on top of the muscle. I personally think it gives a better look. It's not messing with the anatomy. The European plastic surgeons who had access to these implants long before we did have been putting them on top of the muscle for the last 30 years with excellent results. I do the procedure as an outpatient in the hospital under a general anesthetic. It usually takes about an hour. They're in the recovery room for about an hour and then can go home 1 hour after that. If the implant is under the muscle, which I still do in certain patients, the recovery is longer. It takes anywhere from 3 to 6 weeks because I don't want them to use the arms which the muscle is attached to. If the implant is on top of the muscle, I let them resume normal activities within 3 days.